I'm very excited to be presenting the COVID impact survey. So the survey was commissioned to explore the impact of the pandemic from January 2021. So it sort of followed on from an earlier survey by Lung Cancer Nursing UK. And it was also funded by Lung Cancer Nursing UK. And the survey has been designed to explore from the perspective of lung cancer and mesothelioma specialists and advanced practice nurses the impact of COVID-19 on ways of working and workload, the quality of care that they provide, and on health and wellbeing of nurses. So we've had quite a really good response to the survey. We've had 85 responses. So I'm looking forward to telling you all about the survey next Thursday. It's evident really that there's been massive changes in ways of working as a result of the pandemic. So there's been more people working from home, there's people being redeployed or volunteering in different services, and that's led to staff having to cover. And there's also just been massive changes in the workload because of the impact on patients of delayed services and difficulty accessing services. And that's led to a greater workload of nurses providing emotional and psychological support. And nurses have told us that patients are more anxious and they need more support. And then, of course, there's been a massive move to virtual working. And that's been a big step, and nurses have embraced that. But there's also a big theme in the survey has been about the impact of that and concern that it could have a negative impact, and that there's really no substitute for face-to-face interaction to pick up sort of the nuances and build those therapeutic relationships. So that's been a big concern. Also, the survey looked at quality of care. And because of the COVID pandemic, there has been impacts around that. And nurses have maybe not felt that they've been able to provide the same quality of care because of the move to virtual working, because they felt under pressure, because of colleagues being redeployed, and also because of COVID practices where the access to a specialist nurse haven't been as readily available. So that's had a big impact on all patients. And it's been massive disruption. Also, I suppose what's also impacted on nurses is the access to healthcare. So a lot of people responding to the survey reported that patients haven't been able to access their GP in the same way. So that's sort of rebounded on nurses as well. The survey also asked about the impact of the pandemic on nurses' wellbeing. And this question looked across the whole of the pandemic since March 2020. And we can see from the responses that there's been a big negative impact on emotional wellbeing and mental health. And there's also been an impact on physical health and wellbeing. But we also see positive impacts. There's been amazing team support and team working. There's been collaborative working, and there's also been innovation where the pandemic's given people the opportunity to look at services and review things and make improvements. So there's been examples of new nurse-led clinics allowing a more holistic follow-up, wonderful examples of collaborative working and teamwork. So all those things are really positive. So yeah, in terms of the sort of main messages from the survey, I would say that the pandemic's had a significant impact on working workload and on physical and mental health in nurses. Patient pathways have been negatively impacted, and there's also been strong concerns about the move towards virtual working and the lack of face-to-face interaction. But whilst there's been hardship, there's been also evidence of resilience, of innovation, and of incredible team working. So what we're going to be doing is working with Lung Cancer Nursing UK and Mesothelioma UK to develop recommendations. So we'll be looking for strategies to further develop innovations, resilience, team working that have helped support nurses and patients throughout the pandemic.